Hi, everyone. This is Jessica Rial from Southern Pelvic Health, and we are getting started in October with doing a provider spotlight each month. Our goal for our provider spotlights is just to introduce you to some of the excellent providers in the area that we work really closely with so that you can better understand different providers who might be important team members in your care. I'm very excited for our first provider spotlight to have two of my very favorites with us on this little video. And so I have Dr. LaSonya Roberts-Lopez and Christian Marcum with me today from Wellstar Urogynecology. So thank you so much for joining me today and introducing yourselves to our community. If you can start by just telling us a little bit about yourself and about a little bit about your background, that would be great. We'll start with Dr. Roberts-Lopez.
Hi, everyone. I'm Dr. Roberts-Lopez, and currently I work at Wellstar Urogynecology. I actually am from upstate New York, Buffalo. Most people know about it because of the horrible winters. I tell people that I'm more so Canadian than American. But anyhow, I came down here to go to Emory for medical school, went back to New York to do residency, and then came back down here to do my urogynecology fellowship. During my medical school, actually at Emory, and during my residency, I just fell in love with pelvic floor health for women. I actually initially started medical school thinking I would be a pediatric cardiologist, and then I realized that I cry a lot when children are sick. And I also realized that I worked very well with my hands, that I wanted to do something surgical. And so when I did my women's health rotation with residency, that's when I fell in love with it, and I felt that Urogyn was an excellent combination, treating the entire female as well as being able to do some surgical procedures. So most of the patients that we have, they come to us for issues with pelvic organ prolapse, which we can get into later, urinary incontinence, some fecal incontinence, sexual dysfunction, chronic pelvic pain. So those are the majority of the conditions that we treat. And we can talk about those things a little bit later after Christian introduces herself.
Awesome. Well, Christian, tell us about you.
All right. Hi, I am a born and raised Georgia girl. I grew up in Rome, which is North Georgia, moved to Atlanta, went to Emory as well, as Dr. Lopez did. After school, I got my start in women's health and labor and delivery and worked there for about 6 years. I went back to grad school and stayed in the women's health field. And I've been working with Dr. Lopez for going on 3 years now. I've been with her. Loved every minute of it, but been with her for about 3 years and have learned a lot about the pelvic floor in that time. So I love working with urogynecology, actually.
Awesome.
Thank you.
And Christian is a nurse practitioner.
Yes.
And so Christian and Dr. Roberts-Lopez work really hand in hand. So if you're a patient at their practice, you might work with both of them for your care, which I think is a huge benefit to patients. Now, when people hear urogynecology, some people don't really understand what that is. And I hear a lot of confusion from patients with how urogynecology fits, and how it's different than urology versus gynecology. So can you all talk just a little bit about urogynecology and your practice? And I know you mentioned, Dr. Roberts-Lopez, a little bit of some of the areas that you treat, but if you can talk a little bit more about that specialty and why seeing someone like you would be different than seeing a urologist or a gynecologist.
Absolutely. So whenever I give a presentation or just introduce Urogyn to patients, I always tell them, we as urogynecologists, we're the gatekeepers of the pelvis.
Love it.
Yeah, we're the gatekeepers. So basically what that means is that we're not compartmentalizing different organ systems in the pelvis. We're looking at everything collectively. So when you go to a urologist, when you talk about the space that we work in as urogynes, they're going to specifically focus on your bladder and maybe ureters. Then when you go to a gynecologist, they're going to focus on your reproductive organs. And so sometimes when women have pelvic issues, they'll have to go to two different doctors. What I loved about Urogyne is the fact that we look at all the organ systems in the pelvis because we realize how one can affect the other. So sometimes you can have dysfunction, say, for example, in your lower GI tract. So you can have issues with your bowel, and that can affect your bladder function. So we as Urogyne, we're giving you a complete picture of how everything is working together structurally and functionally. So for a prime example, I mentioned that we take care of patients with chronic pelvic pain. Well, when I was in my residency, as an OBGYN, obviously we focused on female reproductive organs. Does this patient have some type of infection? Do they have endometriosis? Do they have adhesion? So those are the things that we focused on. Paid no attention necessarily because it was not, as a gynecologist, this is not how you train, but didn't address really the bladder, didn't address GI function. And what actually, I can tell you the tipping point for me to make me want to go into Urogyne, I can recall I was a 4th-year resident, and there was a young lady, she was in her maybe mid-20s, and she kept coming to the clinic, complaining of pelvic pain. She had pelvic ultrasounds, all type of imaging and tests done, and ultimately she ended up having a hysterectomy. That was the resolution at the time that the physicians that were taking care of her thought she needed, and then she still presented with pain. And so because I had worked with Dr. Lisa Peacock at Emory when I was a resident, a aha moment was like, well, nobody looked at her bladder. And turned out that her bladder was the primary culprit. But because as the gynecologist, at least back then, the focus was not on the bladder for chronic pelvic pain, they actually sent her to a psychiatrist. It said that it was all in her head because she had her hysterectomy. You should not be in pain. So that's the beauty of the relationship that we have with you, Jessica, is the fact that we can focus on, the lower GU tract, the bladder, ureters. We can focus on the reproductive organs. We can even focus on the lower GI tract and collaborate with GI specialists. But the big piece for us is the pelvic floor. The musculature, the nervous system, and even the pelvic bony structures. And the reason why we gravitated towards Jessica of all the therapists that came to talk to us is because she just gets it. She understands the pathophysiology. She understands she understands the anatomy, and you have to have somebody who can comprehensively look at a patient and not just have a cookie cutter treatment for them, but looking at the patient in their totality. So the same way that you, Jessica, incorporate that knowledge and your experience into treating the patients that we see together is the same way as urogynecologists, we look at a patient when they come in, whether it's for pain or incontinence or prolapse, we look at all components. So,
and I love your points with that. And I think it's such a huge piece. When I teach courses in pelvic floor rehab, we always we show this nice image on the screen that is, this cross section showing the bladder, the uterus, the rectum, and we discuss that there's at least one medical specialty for every orifice that a person has. And so sometimes what happens for people is they have this experience of, they see the colorectal provider and some providers, I mean, not all, but some providers focus solely on what's happening with their bowels. And this provider, they might see a urologist who focuses only on what's happening with their bladder. And it's amazing, I think, when providers like yourself are able to, really look at the full person and what's happening for them, because every system in the body is interconnected. I tell our patients, we're not treating your bladder, we're treating a person who has a bladder, and we have to think about that person and how everything's connected. Now, tell me a little bit, what are and each of you I'd love to hear from, but what are your favorite diagnoses, or people who have diagnoses to treat? What do you find to be the most interesting in your practice?
I'll let you go first, Christian.
Okay. All right. Honestly, I think mine is IC. I think that for me, it's one of the more difficult things to treat. And
Can you
it
define
loops
it
into
for a second? Just because there might be people listening who don't know what IC stands for.
interstitial cystitis. So chronic bladder pain, essentially. But yeah, that can be one of the most difficult things to treat. It's what we see a lot of people have come to our office for that have been dealing with it for a long time, undiagnosed. Their prior providers didn't know to look for it or see it. And so, or it could be a combination of many different things that are causing their chronic pelvic pain that you have to look at. And so it can be very complicated and complex to treat. But for me, when you're able to get to that moment with a woman, it's such a joy because they've a lot of times been dealing with it for so long. And I have spent time with patients where they show so much gratitude and they're just so happy because they finally have a sense of relief, and their quality of life improves so much for that. And so for me, that's my personal favorite would be interstitial cystitis.
Love that. It's, I think research tends to indicate that most people with chronic pelvic pain see at least 6 different providers before they get helpful treatment. So, and I think people who struggle with chronic bladder pain with interstitial cystitis are definitely one of those groups that tends to go through that. Now, what about you, Dr. Roberts-Lopez?
Well, Christian actually stole my answer, but then I got to thinking, actually, all the patients that we treat, they're my favorite. And honestly, it is because most of the patients, some patients do find us on their own, but most of them are referred to us because initial steps have been taken and there has either been temporary change or no change at all. And the fact that we're able to put all the pictures together, look at what has been done for them, and then explore things that has never been offered to them. And like Christian said, you make a change in their quality of life. That is so rewarding to be able to do that. Just to kind of piggyback off of something that I said earlier, our specialty is definitely different in that I feel like we give a global picture, but that doesn't mean that sometimes a patient does not need a multidisciplinary approach. So even if you come to a urogynecologist and say, for example, there's a bowel issue, it may be that I have to do a joint procedure with a colorectal surgeon, or you may have to see a GI doctor. Probably 95% of my patients, they go to Jessica for pelvic floor or a pelvic floor physical therapist anyhow, because I feel like no matter what we offer, even if it's not the only treatment, it's definitely the ultimate adjuvant treatment, and it gives us better results. But anyhow, whether it's prolapse, and for some patients that don't know, they may hear somebody told me my bladder dropped. So that's just a form of prolapse. And sometimes patients may come in and it's not their bladder at all. And that's only because other physicians may not be trained to know that, and which is fine. That's why we're here, to provide that information for the patients. When it comes to urinary incontinence, you'll have patients that will come in and say, I just want a medication. And it may mean that they just honestly just need pelvic floor physical therapy, or they may need a surgical procedure, because there are different types of incontinence. So I feel like, honestly, all of our patients, because we do a lot of education, like patients are totally oblivious. They get a lot of information from friends that may not be accurate for them. It may be accurate for that friend, but because the friend may not have all the information that they need to decipher that, that's what the physicians are here for, then we're able to educate them so they can make informed decisions about their options, and knowing that they do have options and it's not just one particular fix.
Mm-hmm. Yeah, I love that. I think that a multidisciplinary approach often is so beneficial for people. And I think one of the things you were talking about that I think is just a theme going through this is how life impacting pelvic floor conditions often are for people. And I think that that's one of the things that makes working with people with pelvic health problems such a rewarding thing for those of us who work in this field, because I have a lot of people, for myself as a pelvic floor PT, who'll say like, how did you get into this? Because they think like, you know, who would want to talk about bladder, bowels, and sex all day, you know? And but it's interesting because I think for me the biggest thing is that the problems that people have when it comes to pelvic floor challenges are so impacting, and I think it is incredibly rewarding as a practitioner to be able to make a difference in people's lives in this way. And I know you all feel that too.
Yeah.
Now, people
I
listen.
was just even when Christian was speaking, and now that you're speaking, it's one patient that will always stick with me. She actually came to see me. I probably was in private practice for about maybe 3 years, and she was so distraught because she'd gotten married and was not able to consummate her marriage because she had so much pain. So, you know, obviously did the typical assessment that a urogyne would do, found out that she had some pelvic floor issues. She had some spasms. Like, most women don't realize that you can get pelvic floor spasms, just like getting a Charlie horse in your leg or getting a spasm in your trap muscles. So anyhow, she had that. I diagnosed her with IC, and I just said, just be patient with me. It's going to be a process. It's not like taking Tylenol for a headache and it goes away. And that's one of the things I want to encourage patients that's doing pelvic floor too, that it's not going to necessarily be an immediate resolution. You may see some immediate changes, short-term changes. And so she was patient with that, and she did her due diligence at home. And when she finished the initial stages of the therapy that she got from physical therapy and medical wise from me, she came back pregnant. So I said, well, I guess it worked.
I love it.
Whatever we did. So yeah, so that is very gratifying to be able to make a difference, you know, for somebody like that. It definitely is.
Mm-hmm, mm-hmm. And I know the people who are listening to this right now are part of the Southern Pelvic Health community of patients. And so everyone listening likely has some degree of challenges that this kind of resonates with. And this, of course, for you reinforces also what we tell you, which is that you're not alone, that these problems, you know, you're hearing these stories, that there are lots of people who deal with pelvic health challenges. Right. Now, if someone is listening to this and is struggling with pelvic floor challenges, what would be something that you would each want to tell them, want to share with them?
Do you want to go first, Christian, or you want me to go?
I will. I think the main thing, I see a lot of patients as we're doing our consults and our initial evaluations of patients, they're so hesitant sometimes, especially with fecal incontinence. Some of these issues they've never wanted to even share with their physicians before, their medical providers before. And so sometimes you really have to, or whether it's, you know, painful intercourse or, you know, they think that they're very abnormal. They think that it's not common. And we don't hear a lot about it. And I think they have a fear of being judged sometimes and not really knowing what to expect. And so when we ask those, we try really hard to ask those specific questions, because a lot of times people aren't just going to say that to you, because they may come to us for one thing and we find out that they have a couple of other different things too that are going on that they have just been embarrassed to say. So I think my one piece of advice is to trust us, trust your providers, because we're here, because sometimes they all link together, and it's important for us to get the big picture in order to help you. And things are more common than you think. I hear it every day. Do you see this a lot? Do you deal with this a lot? Especially pelvic organ prolapse. And I said, well, you're about the 4th patient today already, you know, and, you know, so it makes them just know that these are things that so many women deal with. And that's what we're here for. And that's what we deal with all day, every day. And that's what we love to do. Yeah.
Right. I completely agree with Christian on that. I think the approach that we use in our office is to first make patients feel comfortable, because this is not anything that you need to be embarrassed about. These are just conditions and issues that they weren't talked about before, but it doesn't mean that it's not common, and it doesn't mean that there are no resolutions to help improve your quality of life. We do ask standard questions that probably won't be asked by, you know, the primary care physician or primary GYN doctor. But again, we stress that the more information you tell us, the better we'll have a chance of completely, if not optimally, correcting or managing your issue. So advice I would give patients, again, like Christian says, first of all, if you have an issue and you don't feel comfortable with the options that are given you, always get a second or a third opinion. Okay, because I feel like you have to, especially when you deal with urogyne issues, you have to trust your practitioner, whether it's a physician, nurse practitioner, nurse. I feel like the staff and the team that we have, we do, or at least try to do, a very good job as making the patients feel like family. And I always tell patients, I'm going to treat you the same way I would treat one of my family members. So just having that comfort level will allow patients to open up and, you know, discuss things. And also just saying those things, like I said, it will help you get better outcomes, because then we can address each component of your problem. So that's pretty much it.
I love it. Well, thank you guys so much for being here and chatting with me and introducing yourself to our community. If patients are listening, and if anyone listening needs to connect with a urogynecologist and wants to connect with you, what's the best way for them to reach you in your office?
So I'll let Christian give the details, but you could either, the best way is probably to call the office and make an appointment at this current time. So that's probably the best way.
Okay.
Would you agree?
Yes, yes. Would you like us to share our office number, Jessica?
Well, thanks for the video, so it'll be easy for people who are listening.
Yes, it's 770-590-4175 is our office number. And we are at East Cobb Health Park on Roswell Road, and we are at the Kennestone location at Kennestone Hospital. We see patients in both of those offices. Same office number, though.
Excellent. And are you all doing virtual care as well as in-person care?
We are.
Awesome.
Yeah. And we especially like to do virtual with new patients who do not have urgent issues that have to come in right away, because it'll give us an opportunity to have a longer discussion with them, so we can explain things the way we're explaining them to you right now, answer questions. We, you know, usually will mail out some literature so that they can read and do whatever research, so that when they come into the office, they're already educated about a conversation that we've started about their issues. So we definitely do those for sure.
Excellent. Excellent. Well, thank you so much for being here with us today. And definitely, if you're listening, if you need help with your urogynecology problems, feel free to reach out to these amazing practitioners. Thank you.